this Friday afternoon. And as I mentioned earlier on, we do have some studio guests, as you can see them on the screen for a few seconds there. So I'll do the introductions in a moment. I've been talking about it. Well, Singh FM been talking about it for quite a while, but it's around coronavirus misinformation. And today we got some doctors who are local doctors, practicing doctors, and that'll be sharing some information with you. We'll be doing some myth busting. If you have any questions, you can always drop us a message here in the studio. If you have WhatsApp, 01642688104. We'd love to have your questions as well that we can put to our GPs. And also I'll have Mark Adams, who is the Joint Director of Public Health for the South Tees area. I'd like to welcome you all, gentlemen, to the studio, and let's get you all on the screen and welcome you. If you are watching this live on Facebook or YouTube, make sure you hit the share button. That will be very much appreciated. Let's get these messages and information out as wide as we can. So in no particular order, I'll go through the screen and I'll say hello, assalamu alaikum, and a warm welcome to Hassan, Tahir. And Hassan, how are you?
I'm fine, thanks, Idrees. Walaikum salam. I'm fine, thank you.
And a warm welcome and a Sat Sri Akal to Rashpal Singh, who is looking very smart in his office today. How are you, Rashpal?
Sat Sri Akal, Idrees, thank you very much for having us on the show. Really well, thank you.
Okay, we'll do a bit more of an introduction in terms of your backgrounds as well as GPs, and also Mark Adams, who is the Joint Director of Public Health. So Mark, welcome to you. I know you're a very busy man in back-to-back meetings all day, but thank you for making time for us today. So would you like to say a warm welcome to you as well, and say hello to our listeners, our viewers?
Thank you very much, Idrees. It's great to be here, and I've made a note that I wasn't very smart according to your introduction. I'll just make a little note of that. It's perfectly accurate, yes, but I feel like I should make a note of it.
No, you've got a very smart window box in the background there, actually. So, so Mark, just starting with you first, what is the current situation in terms of COVID-19 in Middlesbrough and the Teesside area? As a way of an update, would you like to share with our listeners and viewers this afternoon?
Yeah, sure. So the figures are coming down in terms of community rates. So we talk about rates per 100,000 of the population. Middlesbrough is currently at 347 and was at a peak of 676 on the 4th of January. So there was a big sort of post-Christmas surge and the rates went up really, really quickly, a lot quicker than they had done in the autumn period. And then obviously the national lockdown has come in and we've started to see that affect things. I think the key area which our colleagues will probably be able to talk about in more detail is the hospital, because their cases picked up very quickly. In fact, picked up before the community cases picked up, which was very concerning. Those cases numbers are starting to come down a little bit more now. So there's 178 inpatients at South Tees with a COVID diagnosis, and at its peak it was around about 250. So that has a significant effect, because obviously there's people in hospital that are ill with COVID, but also crowds out care for other people that might want to be accessing care. And obviously the message from the NHS is everything's open for people to access care, but there is a limit to the beds that the trust have available. So the more that rate of COVID patients increases, the more difficult it is for the trust to manage routine care. So the sort of non-urgent elective care has been stood down at the moment to make up for that capacity. So our role in the council is a little bit limited to supporting the NHS where we can, and really we're just hoping to see those, or just waiting to see those rates drop, keep the rates in the community and see those drop even lower and keep them as low as we possibly can, so that the hospital can recover and then make good over the summer period. Really, I think that's the critical thing. So I think we saw the effect of the new variant in the Christmas period was highest in Middlesbrough, Wrekin and Cleveland out of the whole of the northeast area, for reasons that we don't really understand why that would be the case. And I think that's why we saw those really high rates of transmission in the community. So rates are high, coming down, and we just need to see them come down even further, really, I think is probably a summary of where we're at, Idrees.
Okay, and in terms of the vaccination program, how is the council supporting that, and from a public health point of view?
Well, at the moment we're supporting. We work with some primary care networks, the 6 primary care networks across South Tees, and we work with 2 in Redcar very closely and 1 in Middlesbrough quite closely, which is just a kind of as a result of the social prescribing service that we provide to those 2 in Redcar, and some relationships we already had with Central Middlesbrough Primary Care Network, and we've just offered whatever support is required. I think in this next phase we'll have a bigger involvement in trying to ensure that the sort of flat spots where the uptake is lower are picked up with pop-up clinics and the like. I'm not too sure of the process to make those happen yet, but that's where my interest is to make sure that, be it certain communities like the BAME community, for example, or geographical communities, or people with a mental health issue or a learning disability issue, to make sure that the coverage is as good as it possibly can be in those communities. I know we've talked about vaccine disinformation before, Idrees, and making sure that people are clued up as possible of the importance of taking the vaccine to protect themselves and their families. So I think our role will increase around supporting the NHS to deliver to communities that perhaps haven't, for varying reasons, accessed the vaccine in the rates that the kind of average tells you. That average is always high. The people that haven't taken it are generally, in almost all screening programs, the people you'd want to take it first. So that's what our role will be, in trying to ensure that we get the uptake as high as we possibly can, so that we can keep the communities, all communities, as protected as we possibly can.
And the council and your team within public health has been quite proactive in terms of messaging. We've seen bits and pieces in the local media and television as well. There is real concern that misinformation and conspiracy theories will prevent people or discourage people from coming forward and taking vaccination when they receive their invitation. So it's important that we get accurate information out to those communities. And I believe you have a COVID champions network from different communities that are helping and supporting the council in this work.
Yeah, so part of the purpose of the COVID champions was I'm really clear that, well, I mean, this is stating the obvious really, but it's not always apparent in how we behave, that excuse me, I'm being photobombed by my cat, which he always knows when I'm on something that where he shouldn't appear, and then that's when he's certain to turn up. We need to know what's happening in communities and what issues communities have got. So initially the COVID champions were around, and they still are around, understanding what issues there are in community around difficulties about isolating if you're positive or if you're a contact, to understand what families and people can do to keep themselves and their families and their communities safe, what social distancing means, what the kind of hygiene measures that people in communities might want to take. But equally importantly, it wasn't just about messages out. It wasn't just transmitting. It needed to be about receiving as well, and understanding what the issues in communities are that we might have a part to play in improving those, be that in terms of how we shape our messaging or how we work with specific communities to support that. So Middlesbrough Council's been very active in terms of the £500 isolation payment. So the finance department actually looked through, I think nationally it's around about 80-85% of applications are turned down, and we've worked to say that the whole purpose of testing is for people to isolate if they're positive or if they're a contact. If they don't do that, there's almost no point in testing. And we knew that one of the principal reasons why people might not isolate is because it was financially very difficult for them to do that, because it might mean that they couldn't afford to feed the family and all that sort of stuff. So that's obviously critically important for people to do the right thing. And Middlesbrough Council continually go through looking at the people that have been turned down through the national criteria, and we've got flexibility to apply local criteria and keep finessing them to make sure that we can increase the uptake that we've got. And I think the last figures I saw, it was around about 30% of applications were approved, which is about double those in other areas. So we're doing everything we possibly can to ensure that the barriers to isolation are removed where we can. And I guess there's things like working with people that live in houses of multiple occupation where you've got more contact points and it's harder to isolate because there's shared facilities, shared bathrooms, or even buildings where there's a common lift and multiple touch points. How do we work to ensure that people in those settings can be as safe as people in other settings? So it's the whole approach is really to try to focus our efforts on those people that might find it more difficult to do the right thing, not because they don't want to do the right thing, but because of other factors outside of their control.
That's great. I want to bring Dr. Hassan into the conversation and looking at it from a community perspective. I'm sure you've received some of those messages on WhatsApp and other messaging platforms, giving lots of conspiracy theories and giving false information about COVID-19 and 5G and various other things that you've come across. What can you do to ensure that we get accurate information to our communities, Dr. Tahir?
I mean, that's one of the main reasons why we're coming on shows like this, Idrees, and making sure we try to counteract a lot of the theories that people have got. And what we find is, like with any news, bad news spreads quicker than good news. And some of these theories spread like wildfire on social media. It's really important that our community have got access to people that have got accurate information and that they're able to ask us questions that we can give them the right answers. So that's what we're here to do, hopefully.
So, Rashpal, it was yourself that approached the BAME network and suggested that we have this particular program. In fact, I did have Dr. Iftihar Lorin this morning as well. I did a short interview with him about his experience because he was as a GP. He got COVID last year and he was quite ill. So he shared his experience, and obviously, thankfully he's a lot better now and he's out working and vaccinating. So it's great to see that people from the medical profession are proactive and want to get the messaging out to our communities. So what's your take on this, Rashpal?
Yeah, so first of all, thanks a lot for having us on the show, Idrees, and really at short notice. I'm a GP in Middlesbrough and Hassan is a GP over in Billingham. And both of us have been, and it's really important at this present moment in time that access to health professionals is at a potential all-time low. Both me and Hassan, we have patients who come into our surgeries who might speak to us in Punjabi or Urdu. And I think at the moment, they're finding it very difficult to access some help in order to ask some questions. So we thought, what better way would it be for us to get out there, go to the community and talk about this on the radio? So we first of all wanted to explore the question why this is really important for the BME community. And Hassan's going to answer that question.
Yeah, thanks, Rashpal. Yeah, so we know that the rates of death for people who suffer COVID-19 are much higher in people from the BME community, and the Office of National Statistics, when they've looked at this, every single ethnicity is got higher rates of death in it compared to the white community, and there's a couple of different reasons for this. Initially, it's to do with the health conditions that a lot of people in our community have got in terms of heart disease, diabetes, obesity. They have a big impact, but also in ethnic minorities, there are high levels of deprivation and other socioeconomic factors as well. And these all contribute towards the increased rates of death that we're seeing when we compare that to white population in all age groups, and both in males and in females. The statistics count death as from the statistics, but what people fail to realize is the long-term effects of COVID. That even if you recover from it, how it can affect people. And you mentioned Dr. Lunn, the long-term effects that people get even after they recover. And Rashpal, do you want to add something more about that?
Yeah. So the whole rhetoric.
Sorry, Rashpal, you heard the term long COVID. Just can you explain that as part of your answer as well? Because that's a comment that's come on Facebook as well.
Yeah, so we've spoken a lot about mortality, and that's the message that generally comes across as mortality. But one of the things we don't talk about is morbidity, and that's the impact that a disease can have on you long term. And we call this long COVID. And these are the longer term symptoms that we're seeing in patients. And this is something we haven't spoken about, and it's quite unfortunate. And some of the common symptoms that people are getting is, particularly, they're getting very fatigued, which means extreme tiredness. They're also suffering with long-term chest issues, so that can lead to shortness of breath, inability to exercise as usual, and a chronic cough. Some patients are also suffering with aches and pains and joint pains for a long period of time. And in some patients, it can even affect their thinking and concentration, and that's a term which we call brain fog. So it certainly has potential for long-term symptoms, and that's what we call long COVID. Now, we wanted to talk about the vaccine, and in the time we have, we really wanted to dispel some myths. So I'm going to ask Hassan to talk about the effectiveness of the vaccine. So how effective is the vaccine, Hassan?
So the two vaccines we're going to talk about is the first one that was authorized, which was the Pfizer vaccine, Pfizer-BioNTech, and the second one, which is the AstraZeneca, or what people often refer to as the Oxford vaccine. Now, the government recently changed the dosing regime from 2 injections at 3 to 4 weeks apart to 1 week, to only having 1 injection. And this was taken in with the MHRA, which is the Medicines and Healthcare Regulation Authority, and with the JCVI, which is the Joint Committee on Vaccination and Immunizations. Because what they found was, even after the first injection, we saw big levels of protection from COVID-19. So with the Pfizer vaccine, we're looking at levels of 90% effectiveness. And with the AstraZeneca one, we're looking at over 70% effectiveness. And when they talk about effectiveness, the two main things that they look at is people being admitted to hospital with COVID-19 and people dying of COVID-19. So they're the two big things that this vaccine will protect you against. The reason why the government made the decision to extend the gap between vaccine doses was so we can vaccinate as many people who are at risk as possible. If you're getting high levels after just 1 injection, we can vaccinate double the amount of people in that time. Then that's going to save an awful lot of lives, and that's why they made that decision. These vaccines are in short supply. There's no doubt about that, and we want to try to get this vaccine out to as many vulnerable people as possible. And so that's the rationale behind that. We're going to dispel a couple of questions now, really, about that people have sent in about the vaccinations and about the vaccines as well. So, Rashpal, one of the questions that came in was that these vaccines have got the ability to change our DNA.
Okay, so it's clear this does not change your DNA. What this does is programs your body to recognize when we may actually be infected by COVID-19, so our body can mount an immune response. And what that means is that our body can then fight it off. It already has the ability to fight it off if we ever come across COVID-19 in the future. So the key message is it doesn't alter your DNA. One of the next myths we have is, can this be used in pregnancy, and is it safe?
So when these vaccines have all been through rigorous trials in the way that all medicines have to go through before they get authorized. However, in these trials, they don't include pregnant women. So one of the big myths is that the effects it will have on women who are pregnant and on their fertility. The trials haven't shown any impact on fertility. And once the vaccines were authorized, as a matter of course, they're always, as a precaution, not advised in pregnant women until more data is available. We know that in the USA, the Food and Drug Authority there did authorize these vaccines to be used in pregnant women. And more recently, the Royal College of Obs and Gynecologists in the UK have looked at the data and decided that for women who are pregnant, they can have the vaccine, but it's a discussion that you should have with your doctor to weigh up the benefits of having it and the cons of and the risks of having that of the vaccine. So for women who are at very high risk, the benefit may be to have the vaccine, and for those who are at low risk, it may be that you don't have the vaccine. It's on an individual basis. For women who are breastfeeding, they have found that it is safe to use, and women who the vaccine, and again, they weren't included in the trial. But after the trials, the data that people analyze, that the authorities have analyzed, have said that it's safe to use in breastfeeding women. So they should be offered the vaccine if you're at high risk. Another question that people often ask is COVID not just a more serious version of flu?
So the answer to that is COVID is not a more serious version of flu, and that's for two main reasons. Number one, the mortality from COVID is 10 times higher than what it is from flu. The second thing is that with COVID-19, there's also a lot longer side effects from this. So that's where we talked about long COVID earlier on. So two things, higher mortality and longer term effects from it. The other question, which is really important for us to talk about is, especially for our BME community, is the COVID-19 vaccine halal?
Yeah,
there's another question that's just come in as well from a caller ending in 573. They didn't have no name. They were asking in specifically for Muslim communities, because there is a talk about it containing animal products and pork and all sorts of things that are circulated. So and again, I suppose that it also comes from a Sikh community as well, Rashpal. So if you're from a Muslim faith or a Sikh faith, is there anything that prevents you from getting taking the vaccination, Dr. Hassan?
Thanks, Idrees. When they make these vaccines, they have to be very clear about what goes into these vaccines. And both manufacturers have categorically said there's no animal products in either of the products of this vaccine. Not only are there no animal products, there are also no fetal products, which is also a myth that is being going around, that these vaccines contain remnants of fetuses. And again, that's not true either. Both of these vaccines have been certified as halal by the majority of scholarly bodies worldwide, not just in the UK, but in other Muslim countries as well. And they've also been certified as safe for vegetarians as well in the UK. So, and this has not just come from the manufacturers, but also from the MHRA that provide all this information as well. The next question that comes up quite often, Rashpal, is the deaths from COVID-19 have been hugely exaggerated by the government and the authorities.
Now, I can see why people come up with this, and there's lots of different theories out there. From a personal level, what we've seen in general practice is that, certainly we've had a higher death rate compared to usual. And also when we discuss with our colleagues who work in the hospital, there is a significantly higher death rate, and that's due to the COVID-19 infection. As Mark mentioned earlier on, the hospital is also facing increased pressure from COVID-19, and certainly that's something which we have witnessed as well. So I certainly don't agree that the deaths are exaggerated. I understand people may die with COVID-19 and some people may die of COVID-19. And, it's very difficult to say, which one may have led to the death. However, I certainly don't feel the deaths are exaggerated. So one of the other questions we had was, is there any long-term side effects to the vaccine, Hassan?
Yeah, so when they're doing trials for the vaccines, that's one of the things that they're looking for is the short-term effects, but also the long-term side effects. And we have to explain to patients when they're having the vaccine of what some of these side effects will be. The most common being pain and discomfort in the arm, a fever, a temperature for a couple of days. But some of the long-term, there are some long-term effects that people may get. And we're quite lucky in the UK that our MHRA, we have what's called a yellow card scheme, which is something that all long-term effects from potential vaccines, we're duty-bound to report them to the MHRA. And they look at all this information and they look at whether any of these long-term effects can be linked to the vaccine or whether it's something that is unrelated to the vaccine. And this is something that's ongoing. This is something that happens continuously while we're doing this. So far in the UK, we've done close to 10 million first doses of vaccine. And the amount of reporting that's going ahead to the MHRA means that they're collating and putting together lots and lots of information about the long-term side effects from this. So we're very lucky that we have a system like that where even afterwards we're still constantly looking for side effects from it and trying to report them. One of the common sort of questions that comes up is about wearing your mask and how important it is to wear this mask and whether social distancing is actually making any difference to anything.
Yeah, so a really important question. Two important things to remember. wearing a mask protects us, and it also protects the next person as well. You know, if somebody does have COVID-19, if they are wearing a mask, the chance of transmission is reduced. Now, there's all sorts of discussions about different masks, and we won't go into that. However, it's really important that we do wear a mask to protect ourselves and protect the other person as well. And then one of the final questions was about the vaccine and virus spread, Hassan. So you were going to talk about that.
Yeah, so the vaccination in the trials, what they looked at was how the effectiveness, as we explained before, was, is it stopping people from getting really severe COVID-19 or dying? And the vaccine has shown to be really effective in stopping people from getting those end results, that they're dying and from getting really severe COVID-19. However, what wasn't clear is how effective it is at stopping the virus from spreading. The reason why that's important is because even if you've had the vaccine, you can still pass this virus on to people that are vulnerable and haven't had the vaccine. And if you pass it on to someone who hasn't had the vaccine, they're at risk of getting COVID-19 and at risk of dying as well. So just by having the vaccine doesn't mean you should let your guard down. It doesn't mean you shouldn't follow the guidance that is in place about social distancing and wearing your mask, because you could still pass this virus on without knowing. So that's really, really important, that this vaccine, although it could save your life, isn't a shield of armor that you can wear around and ignore all the advice that's going on. It's really important that we think about the wider public and we think about our loved ones and think about the risks that we're putting them at if we don't follow these rules.
So whilst we've been on now, we've had some comments, and I'd like to add some of those comments here on the screen. Naheem Benares has just commented, and he said, thank you for sharing this valuable information and guidance. Thank you for your comment, Naheem. I've had a message on WhatsApp, and this is from Sophia. And she's asking, can it affect women's fertility in the future? So if someone who is of a childbearing age and they receive the vaccine, people are concerned that it might affect their ability to have children in the future. Is there any information, any light you can shed on this?
Yes. So as I mentioned before, when they do the tests, when they do the trials, they can't check for, they don't do trials on pregnancy, and also they don't do trials on fertility. At the moment, there's no evidence at all that these vaccines, either of the ones that have been authorized, that they will endanger future pregnancies or that they increase the risk of miscarriage. What these vaccines do is that they trigger your immune system to recognize the virus when it sees it. And some of the myths that people have said is the body can get confused and can start attacking itself and cause things like miscarriages. There's been no evidence to show this at this moment in time. So the vaccine is completely safe. It has no negative impact on fertility, and it doesn't increase your risk of having miscarriages either.
Yeah. Let's not forget, when it comes to vaccines, Idrees, like in this country now, we don't actually see many. There's many diseases which we don't see. And me and Hassan were talking about this earlier, and many of the BME community will have gone back home to India or Pakistan. And we'll see diseases like typhoid. We'll see diseases like polio, and the long-term effects of that. And we just don't see them here, and that's because of an effective vaccination program. So we certainly feel really passionate about the fact that if you do get an invite to come and have the vaccination, then certainly do take it. Both of our parents will be encouraging. I'll be encouraging my parents to go and have it. I'll probably have to force my dad to go and have it. But my grandma, she's already had the vaccine. So we'll certainly be advocating it. Both myself and Dr. Hassan have had the vaccine ourselves as well.
So a comment from a Facebook user, probably in one of the groups where we can't see the name, saying this: the vaccine is worrying those with underlying conditions and those who suffer from allergic reactions. So if someone that has any types of allergies, is it more dangerous for them, or is there any evidence of that?
I think the answer to that is it's not more dangerous as such. One of the vaccines, the Pfizer vaccine, there's more guidance around that anyone who has a severe allergic reaction And by severe allergic reaction, we mean people who've had something called anaphylaxis, which means that you'd carry around something like an allergy pen or adrenaline pen, and you often end up in hospital. If you have allergies to that extent, then those people are not suitable to have that Pfizer vaccine. However, we've not seen that with the Oxford AstraZeneca vaccine, and that's why that's an alternative that those patients are being offered. So if you've got severe allergies, the Oxford vaccine is shown to be completely safe for people with that. However, it's always best to discuss it with your own doctor. If you've got concerns, speak to your own GP, speak to them about, your allergies that you have. But it is the severe allergies. If you suffer with, a bit of a tummy upset, or the tablet doesn't suit you, that we wouldn't class that as a severe allergy in this case. And it's only for those people that carry something like an allergy pen with them.
And obviously, one of the impact of COVID-19 and the whole pandemic will be on people's mental health. The impact of the virus we are seeing, and that's in front of us. So, Mark, what is the council and public health's take on supporting people? Because talking to charities that work within the mental health field, the uptake of their services have gone through the roof. So what is the thinking in terms of long-term impact on people's mental health as a result of the pandemic? You might have to just unmute you.
Were you asking me, Idrees? Sorry, you froze just at the point that you were asking me a question about.
Yes,
was it about?
Mark, I was asking about mental health and the impact as a result of this pandemic.
Yeah, and I think that's a bit like the discussion about long COVID. One of the longer term implications, and I guess current implications, is mental health. Whether that's brought about from feelings of isolation and loneliness as a result of the sort of changed circumstances that we're in as part of lockdown, or whether that's anxiety about the health of older people in your family, or whether that's about anxiety about your own health. That mental health issue is one of the things that I think we're going to be seeing now and over the following months and years. I was at a launch of the Wellbeing Network yesterday that's looking at how can we connect community organisations to better share best practice, share understanding of the issue. Sorry, I got somebody trying to call me. And linking that in with the services provided by Tees and Weir Valley, we had a presentation to the Health and Wellbeing Board a couple of months ago looking at mental health and how might we consider what the response is to support people that are struggling as a result of their mental health, either at a very low level or more significant. So I think alongside the long COVID, that's something that's current in terms of people's anxiety and loneliness, but also a longer term issue that we've got to be considering. I was talking to the people from the university, from Teesside University, on Wednesday, and they're concerned about loneliness of university students, because obviously you go to university at the moment, it's not the same experience that you'd expect it to be, and potentially you don't live around here, so you're away from your own social networks, albeit you can access them online, and that potential for loneliness, and how we can connect the university into the Wellbeing Network as well, so that we can get some more face-to-face, albeit online, but face-to-face rather than reading materials. Can we have some more access to discussions, or to so services like the access to psychological therapies is online now and is digital or through the telephone. So there's different ways of accessing services now, and we'll need to think about what that looks like as we move forward, and some of those issues become clearer. I'm sure the doctors will have seen issues now as a result of people's concerns from COVID.
Rashpal, as a frontline GP, are you seeing more patients coming in who are needing help and support in terms of their mental health and well-being?
Definitely, without a doubt, and that really was noticeable right from the very onset of the initial lockdown. We obviously, as humans, we like to interact with people, we like to talk to different people, and I think that initial social isolation, whereby we weren't able to go out and socialize with our family, has a massive impact. Families, it provides a support network as well. So for those people who have children, that was initially challenging. And there's a lot of anxiety as well. So if you suffer with a long-term health problem, or for example, you might be an older patient, it's extremely anxious time because you're worried, okay, if I get COVID, what's going to happen? Or if I need to go into hospital, what's going to happen? People are genuinely concerned and anxious out there. So yeah, we are definitely seeing the impact on mental health on this condition. We're hopeful that good uptake on the vaccine will hopefully help to improve the situation. And the final message we really want to get out there is that if you get invited to have the vaccine, please get the vaccine, because it does reduce mortality from this condition. Continue to social distance whilst it's really important. Even if you do get the vaccine, it's still important to social distance, and to continue with regular hand hygiene as well, which helps to reduce the spread of this.
Good advice. And a few last comments from yourself, Dr. Hassan, to our viewers, our listeners today. What's your message, final message to them? I know you guys only blocked in half an hour, and I do apologize for taking longer than that. So what's your final message to our viewers and our listeners today?
I echo everything Rashpal has said, but I just want to add on that doctors' surgeries, we are open. So please, do get in touch if you're having problems with your mental health, if you're feeling anxious, if you're having problems with your mood. Please do get in touch with us. We're still open. GP surgeries are still here, and we do want to offer that support to you. Look out for your relatives. Look out for people in your community. Look out for people on your street. You knocking on the door and asking if somebody's okay, or a quick phone call to somebody. It just helps them know that they're not alone in this process. It's been a long couple of months and people are isolated, and just that one phone call might make all the difference to somebody's mood. So please do think about the wider community and people, and please be mindful of them.
A few comments are coming in. Anila Mohammed saying thank you for all your efforts, and pray for the NHS staff that they stay safe and well through this pandemic. Thank you to both of you for your time. I'm going to go to Mark before we wrap up our conversation and see what Mark has to say. Mark, your final comments as we say goodbye to our two doctors, and to you as well for your time this
Hello,
afternoon.
Idrees. Sorry, I'm having problems connecting. I think you're asking for... Sorry, Idrees, I think you're asking me for my final comments. I couldn't really see because you were just buffering. So hopefully you can hear me. I think just on the case of vaccine disinformation, I think it's worth considering what the motivations behind the people that are putting out the disinformation. And I would argue that it's certainly not to protect your health or to protect your families or protect your loved ones. It's to cause confusion and cause harm. And we need to listen to people in the community.
We're having a couple of connection issues with Mark, maybe a bit of a weak broadband. So I'll go to Dr. Hassan, and maybe he can finish off what Mark was saying in terms of misinformation.
Yeah, I mean, it's so dangerous that the misinformation, and it spreads so quickly. Whenever you see any information, always think about where it's come from. Think about who's spreading the information, and also compare it to what you're seeing from trusted sources as well. Speak to people in the community that speak to your health professional, speak to your GP, speak to anybody that you trust with this sort of thing. Don't ever take these things at face value to start with. It's so important. We live in an age of misinformation about lots of different things. This is something that as we grow up and our children grow up, that they're going to have to become wise to and switch on to.
Yes, indeed. So I think we're going to wrap her up there. A few more comments coming in. There were a few questions that came in on WhatsApp as well. But I'm pleased that you covered a lot of information, and the listeners were wanting to explain as well. So but we will have another opportunity, and just Mark saying, do you want me to come back in? I think we are just about done here. So Rashpal, Hassan, appreciate your time and thank you so much. And hopefully we'll do this again in a very near future. But we thought we share this platform with our listeners, our viewers today, and get some information within our community. So I'll let you guys I'll let you get back to work and enjoy your weekend. A few more comments coming in. Uzma saying thank you. Thank you and well done. Definitely something our community need to hear. Take care and stay safe. Thank you. Another probably through a group. Facebook used to say brilliant show. Thank you 100%. A few other comments coming in as well while we were talking. But thank you to everyone that commented, that shared, that liked, and that took part in any way. Inshallah, we'll be back again with another show very soon. For me, that's all for now on this particular live. If you want to hear some great music for the next 45 minutes, tune over to 104.5 FM or head over to our website. I'm going to kill this live now. So